You'll see some AI-generated images in this documentary, mostly to help visualize events we don't have footage for, and sometimes just for a bit of humor. But we also work hard to show real historical photos and primary sources whenever we can, because we don't want to misrepresent or distort the past. AI visuals are there to illustrate the story, not rewrite it. Tuskegee. It's a word that, for many Americans, doesn't just describe a place or a scandal. It describes a feeling, a warning, a memory passed down, a reason someone hesitates when they hear the words public health. Because this wasn't a simple accident. It wasn't a misunderstanding. It wasn't a single bad decision made in a hurry. It was a decision repeated for years. Here's another decision that could and should be repeated for years, and that's watching every history documentary on this channel. A daunting task for sure, but guess what? If you subscribe, you'll never be out of the loop. And it'll help you keep track as you go through our backlog. Great idea, right? I thought so. Anyway, on to the show. In 1932, the United States Public Health Service began what they called a study in Macon County, Alabama, near Tuskegee. They wanted to observe what happens when syphilis goes untreated. And to do that, they recruited hundreds of black men, many of them poor, many of them sharecroppers, many of them with little access to medical care in the first place. They were told they were being treated for bad blood, a vague local term that could mean almost anything. They were promised examinations. They were promised care. They were promised, in some cases, help with burial costs. What they were not given was the one thing that makes any medical study ethical: the truth. They were not clearly told they had syphilis. They were not told the government intended to watch the disease progress. And they were not told that the treatment they were receiving often wasn't treatment at all. This is where the story usually begins, but to understand why it was possible, why it could run for decades, you have to understand the world around it. Macon County in the 1930s was shaped by segregation, poverty, and fear. Healthcare wasn't something you took for granted. It was something you hoped you could reach. If a doctor showed up offering free help, many people didn't ask for a contract. They asked, "When can I come in?" And that's part of what made this study so powerful. It wore the costume of compassion. The men were examined. They were tested. They were poked and prodded and recorded. And when the researchers wanted more data, they would do something that still feels unbelievable today. They would persuade men to undergo painful spinal taps, telling them it was a special free treatment. It wasn't. It was a diagnostic procedure. It was information gathering. It was the study feeding on human bodies. And the men trusted them, or at least trusted them as much as you can trust anyone when you have no better option. Now here's the moment where any decent system would stop. Because in the early years, syphilis wasn't curable in the way we understand cures now. Treatments existed, but they were inconsistent and often dangerous. So you might imagine a cynical official saying, "Well, it's complicated." But that excuse has an expiration date. By the 1940s, penicillin emerged as a highly effective treatment for syphilis, and by 1947, it was widely recognized as the standard of care. This is the turning point. This is the line in the sand. At that moment, the study could have ended with integrity. The men could have been informed. They could have been treated. The government could have said, "We were wrong and we're stopping." Instead, the decision was made to continue, and not just to continue quietly, but to continue actively. Because withholding treatment is one thing, preventing treatment is another. The record shows that the study's administrators worked to ensure participants did not receive proper care elsewhere. During World War II, for example, many men registered for the draft and encountered military medical screenings. Syphilis would be detected. Treatment might follow. And that threatened the experiment. So the study intervened. The machinery of the state, which could have delivered healing, was used to protect data, to protect the study, to protect the project. And this is the part that's hardest to sit with. It was not one villain, not one monster in a room. It was a chain of approvals, a routine, a system that normalized the abnormal, a bureaucracy that made suffering look like procedure. Year after year, men came in. Year after year, they were told just enough to keep them showing up. Year after year, the researchers wrote notes, filed reports, collected results. And year after year, the disease advanced. Syphilis doesn't just sit politely in the body. Untreated, it can cause serious damage over time, affecting the nervous system, the heart, the brain. It can lead to pain, disability, mental deterioration, and death. And it can be transmitted to partners. It can affect pregnancies. It can ripple outward into families. This is not an abstract harm. This is the government watching a fire spread and refusing to hand over water after the water existed. Imagine being a man in that study. You're told you're getting care. You feel the authority of white coats and clipboards. You believe that if something serious were wrong, they'd tell you. And then, over time, you get sicker. Maybe you can't work like you used to. Maybe your body begins to fail in ways you don't understand. Maybe you start losing pieces of your life, strength, stability, clarity, and you blame yourself, or age, or bad luck, because nobody tells you the truth. And then imagine being the spouse, the partner, the family members who watch it happen, who trust the same institutions, who inherit the consequences. Tuskegee wasn't just a violation of individuals. It was a violation of community. And still, decade after decade, the study continued. By the 1960s, medical ethics were changing. The world had witnessed horrors under the banner of research. New standards were being discussed. New rules were emerging. And even then, the Tuskegee Study endured. It became, in a sense, a machine that kept running because it had always been running. That's a terrifying kind of evil. Not the dramatic kind that snarls, the kind that stamps forms. So how did it end? Not because the system suddenly grew a conscience, not because someone in power finally woke up one morning and said, "We can't do this." It ended because the truth escaped. A whistleblower, someone who could no longer accept what was happening, pushed the story outward. The details reached journalists, and in 1972, the public learned what had been done. Only then did the study finally stop. And the reaction was immediate: outrage,
disbelief, a sense of betrayal so deep it felt like a crack in the floor.
The government faced investigations. There were lawsuits. A settlement was reached. Years later, a formal apology came. But no apology can restore a life that was shortened. No settlement can unhappen decades of untreated illness. No official statement can put trust back into a community the way it was before. Tuskegee became a symbol, a shorthand for a specific kind of betrayal, the betrayal that wears a badge. And the long shadow of that betrayal stretches into the present. Because when people today say they don't trust medical institutions, Tuskegee is part of the story. Not always the only part, but a major part. It's one of the clearest historical examples of why distrust is not irrational, why skepticism can be inherited, why just trust the experts can land like an insult when history includes moments like this. And it raises a difficult question that doesn't have an easy answer. How do you rebuild trust after the people tasked with protecting life chose instead to study suffering? The most unsettling part of Tuskegee is that it did not require secrecy at every level. It required normalization. It required enough people to treat it as routine, to accept it as important work, to look away from the human beings behind the numbers. Tuskegee teaches you that harm doesn't always come from hatred. Sometimes it comes from indifference. Sometimes it comes from ambition. Sometimes it comes from the seductive idea that data is worth more than dignity. And that's why it still matters. Because the lesson isn't just, this happened. The lesson is, this can happen when systems stop seeing people. Let's slow down and look at what deception really meant in practice. Because for the men in the study, this wasn't a single lie told once. It was a relationship built on 1,000 small lies. A clinic visit where you're thanked for coming in. A nurse who remembers your name. A letter that arrives reminding you of your next appointment. A government seal that makes it all feel official. And then there were the words, bad blood. It sounds almost harmless, almost old-fashioned. But it worked because it was flexible. It could mean fatigue. It could mean anemia. It could mean a sickness you don't want to name out loud. It could mean, don't worry about the details, just let us handle it. That phrase was a doorway into the study. Because if you never say syphilis, you never have to explain what it is. If you never explain what it is, you never have to explain the consequences. And if you never explain the consequences, you never have to ask permission. Informed consent isn't a signature. It's understanding. It's dignity. It's the right to say no. And the entire structure of Tuskegee was designed to make no impossible, without ever forcing anyone at gunpoint. It's the kind of coercion that hides behind kindness. Even the incentives tell you something. Burial insurance sounds small until you picture the reality of poverty in the rural South. A decent funeral could mean a family isn't humiliated on top of grieving. So when the government says, we'll help with that, it's not just a perk, it's leverage. And then the study just becomes part of life. A scheduled stop, a routine,
a place you go because you've been going.
Now zoom out. Because the Tuskegee Study didn't exist in a vacuum. It existed inside a broader history of medical racism in the United States. Moments when black bodies were treated as tools, not patients. That doesn't mean every doctor was a monster. But it does mean the system had a long tradition of deciding that some people could be sacrificed for knowledge. That's the moral logic underneath Tuskegee. The idea that the men were not fully owed the same care, that their suffering could be justified as a scientific opportunity. And once that logic is in place, the next steps become terrifyingly easy. You tell yourself it's for the greater good. You tell yourself the participants are benefiting because at least they're being examined. You tell yourself you're documenting history, and then quietly, you start protecting the study itself. Because if the study ends, the people who ran it might have to answer for what they did. So when penicillin arrives, it isn't just a medical breakthrough, it's a moral emergency, a test. And Tuskegee fails that test for decades. Imagine the paperwork that had to exist for that to happen. Memos, lists, decisions about who gets contacted and who doesn't, choices about what to tell participants, choices about what not to tell them. That's why the line, "they knew," matters so much, because it means this wasn't ignorance, it was management. It's also why the story doesn't end neatly in 1972. Yes, the study was shut down. Yes, there were investigations. But the deeper question is what it did to the social fabric. When trust is broken at that scale, it changes behavior. It changes whether you show up for checkups. It changes whether you believe a doctor when they say, "This is safe." It changes whether you hear a public health message as guidance or as threat. And you can see that ripple in real life. In communities where people delay care, in communities where rumors outcompete official guidance, in communities where an institution's past is not ancient history, it's living memory. That's the paradox Tuskegee created. Public health depends on trust, but Tuskegee taught millions of people that trust can be weaponized. And here's the hardest part for institutions to accept. You can't lecture people out of that. You can't PR your way out of that. You can't demand faith from people you've given reasons to doubt. You rebuild trust the slow way, with honesty, with accountability, with humility, with systems that are transparent enough to be challenged. Because the real opposite of Tuskegee isn't just better research. It's a different posture entirely. One that treats every participant as a human being first and a data point last. That's why Tuskegee still matters. Not because it's a shocking story you tell once, but because it's a reminder that institutions are capable of repeating harm, especially when harm becomes routine. And because the most dangerous words in any bureaucracy are, "We've always done it this way." Tuskegee proves what can hide inside that sentence. A decision, repeated for years. Tuskegee wasn't a mistake. It was a decision, repeated for years. Thanks for watching. For more history documentaries, check out our backlog and subscribe for new videos every other week. Take care.